Everyone, welcome back to my channel. Today we are going to discuss a very important topic from general surgery for BDS third year, that is burns. Burns is a very common university examination topic, and if you understand the basic classification, assessment and management properly, this topic becomes very easy to write in the exam. Okay, so in today's lecture we are going to cover exactly what you see in this notes: definition, classification according to depth, extent of burn, complications, management, fluid resuscitation, wound management, other management, surgical management and special considerations. Okay, so don't worry, I'm going to explain everything in very simple language with examples so that you understand it rather than simply memorizing it. Okay, so let's start. First comes is definition. Okay, so definition is, first, what exactly is burn? So a burn is a tissue injury caused by heat, electricity, chemicals, radiation or friction, producing local and sometimes systemic effects. So let's make this very simple. Imagine you accidentally touch a hot pen, okay, and the heat damages your skin. That's a burn. Similarly, tissue damage can occur because of heat, electricity, chemicals, radiation, friction, and burns don't always remain limited to skin. Okay. Small burns can produce mainly local effects, while extensive burns can produce systemic complication as well. So now here it comes the classification when we talk about the local effects or systemic effects. That's why. Okay, so first comes extent. According to extent, okay, so according to depth, thickness. So the first comes is superficial first degree, partial thickness second degree. इसमें आता है superficial partial thickness and deep partial thickness, full thickness third degree and fourth degree. Okay, so easy memory is that keep first superficial, okay, second partial, third full and 4 degrees beyond the skin. Now depth of burns में ये डायग्राम, see that diagram, this is very important and इसे एग्ज़ाम में ज़रूर ड्रॉ कर आना. Okay, this is very important diagram. Now we comes to the explanation. Okay, so superficial first degree, first is a superficial burn, and here only the epidermis is involved. Only the epidermis is involved. So remember, first degree is equal to epidermis only. And what happened in this? Red, painful, no blisters, heals in 3-6 days without scar. And this heals without scar. स्कार नहीं आता है इसमें. एग्जाम्पल इसका ले लो, जैसे सपोज यू स्पेंड टू मच टाइम इन द सन एंड योर स्किन बिकम्स रेड एंड पेनफुल बट देर आर नो ब्लिस्टर्स. ओके, सो थिंक इट एज अ सुपरफिशियल बर्न. ओके, नाउ सेकेंड कम्स पार्शियल थिकनेस second degree. Next, here we have two types. Superficial partial thickness, it involves epidermis and epidermis. Its feature is red, painful, moist blisters present, heals in 7 to 14 days with minimal scar. इसमें minimal scar आता है. Is easy way to remember superficial partial thickness, that is equal to red plus wet plus painful plus blisters. Second comes the deep partial thickness. Now the burn goes deeper into the dermis. So the feature involves pale, less painful, fewer blisters, takes more than 21 days with hypertrophic scar. So compare superficial partial, red and painful, deep partial, pale and less painful. Now we come to the third degree burn, which involves the full thickness. So entire epidermis and dermis are destroyed in full thickness. The skin becomes dry, leathery, painless and charred. Heals only by grafting. And importantly, this is the most important point, that heals only by grafting. So the memory आप इसमें क्या याद रखेंगे, थर्ड डिग्री इज इक्वल टू एंटायर स्किन डिस्ट्रॉयड एंड ग्राफ्टिंग इज रिक्वायर्ड. Then we finally fourth degree burn. This extends beyond the skin into the subcutaneous tissue, muscle, bone. It is very severe and may require amputation. Okay, so the one line revision of this, all the according to depth types of burn. First is epidermis, second is partial dermis, third is full skin and fourth is muscle and bone. So this are all the 4 degree of the burns. Now we come into the page number 3, that is according to extent, surface area. Now suppose I tell you a patient has burn and the next question is how much of the body is burned, कितनी body जल गई है, ये next question होता है. So that's called assessing the extent of burn, and we have 3 methods in our notes. The rule of 9, Wallace rule, is very important, whether it is for the NEET, MDS or university exam, it is very important. Okay, so listen carefully. Rule of 9, this is called the Wallace rule of 9. In an adult, head and neck 9%, each upper limb 9%, anterior trunk 18%, posterior trunk 18%, each lower limb 18% and perineum is 1%. Okay, I am talking about this diagram. You can draw in the university exam, it is very easy, फटाफट बन जाएगा. मेमोरी क्या याद रखोगे, 9 9 18 18 18 18 1, ऐसे याद रखना. You can visualize the body like this. Okay, कि head, each arm, front, okay, then back, okay, each leg and perineum. The remaining 1% is perineum. And then comes in the Lund and Browder chart, more accurate based on age. And if the examiner asks which method is more accurate, you can tell Lund and Browder chart. Third comes is palm method. The patient palm including fingers is approximately 1% of the total body surface area. So if you don't have the time to calculate a small burn area in detail, the palm method can be used. Okay, now we comes fourth page, that is complications of burns. Now let's discuss complications. I want you to divide them into 2 categories, local complications and systemic complication. And in local complication, this include burn wound infection, cellulitis, abscess, ulceration, hypertrophic scar, keloid, contractures, malignant change, which comes under marginal ulcer comes in this. Okay, this is also the important point, marginal ulcer for NEET MDS students. Then for simple explanation of local complications, imagine a burn wound heals abnormally. It can produce excessive scar tissue resulting in a hypertrophic scar और keloid. Keloid एक अपने में पर्टिकुलर टॉपिक है और वो बहुत इंपॉर्टेंट शॉर्ट नोट्स टॉपिक है. ओके, उसे हम नेक्स्ट लेक्चर में कवर करेंगे. And if the scar contracts, we can get a contracture, and chronic scar can undergo malignant change, which is called marginal ulcer. So hypertrophic scar हो गया, keloid हो गया, contracture हो गया और marginal ulcer हो गया. ये चारों अपने में एक टॉपिक है, शॉर्ट नोट टॉपिक है. इससे हम नेक्स्ट लेक्चर में कवर करेंगे. ओके, बट अभी तक इतना याद रखो कि इट कम्स अंडर द लोकल कॉम्प्लिकेशंस. ओके, नाउ सिस्टमिक कॉम्प्लिकेशंस में इंक्लूड है हाइपोवोलेमिक शॉक, बर्न्स, टॉक्सीमिया, रीनल फेलियर, respiratory complications, electrolyte imbalance, sepsis and multiple organ dysfunction. इसका important concept ये है कि why does a large burn cause systemic problems? Why? Because when a large area of skin is damaged, the effects are no longer restricted to the skin now, and the patient can develop fluid loss, shock, respiratory problems, electrolyte disturbances and infection. Now we come into the page number 5, that is management of the burns. And management depends on the depth of burn, extent of burn, age of patient, associated injuries and time since burn. Before treating, we need to assess the patient properly, and management of burn depend on this: depth of burn, extent of burn, age of patient, associated injuries and time since burn. So the first comes is initial management, resuscitation. First comes is ABC. Okay, airway, breathing, circulation. Airway maintain patency, breathing give oxygen, circulation treat shock. Remember ABC. Okay, and second comes the remove the patient from the source of burn. So remove the patient from source, इसमें क्या है कि next for example if the person is still in contact with an electrical source, so the source must be dealt with and then the patient removed from danger. Third is remove tight clothing and jewelry. Why? Because swelling can occur after a burn and tight clothing and jewelry can become problematic, so they should be removed. Fourth step comes the cool the burn with running water for 10 to 20 minutes only, and especially in the thermal burns. So the important point is running water is equal to 10 to 20 minutes ही हमें उन्हें उसमें रखना रहता है. 5 is cover the burn with clean, dry and sterile cloth. And finally initial management sequence becomes ABC: remove source, remove tight items, cool and cover. ये initial management है. Then we comes into page number 6, that is fluid resuscitation. Now let's come to one of the most important part, that is Parkland Formula. It is also the most important topic of the NEET MDS or university exam, Parkland Formula. According to my notes, fluid required is equal to 4 ml into body weight in kg into 1% burn. So remember 4 into weight into percent of the burn, ऐसे कैलकुलेट करते हैं. सो एग्जाम्पल, सपोज वी हैव अ पेशेंट वेटिंग 50 kg, वेट 50 kg है पेशेंट का और उन्हें वो 20% बर्न है उनको. तो यूजिंग द फॉर्मूला 4 है ही, बॉडी वेट कितना है 50 एंड कितना परसेंट बर्न हुआ है 20. तो इससे कितना फ्लूइड रिक्वायर होगा वो हम परसेंटेज हम निकाल सकते हैं. सो द टोटल फ्लूइड रिक्वायरमेंट इसमें क्या, मैं जो एग्जांपल दिया 4000 ml. सो हाउ डू वी गिव दिस, अब हमें पता चल गया तो अब हम देंगे कैसे. तो हाफ इज़ गिवन इन द फर्स्ट 8 hours फ्रॉम द टाइम ऑफ बर्न, ठीक है, एंड रिमेनिंग हाफ फिर 16 hours में देते हैं, एडजस्ट अकॉर्डिंग टू द यूरिन आउटपुट. अडल्ट में यूरिन आउटपुट 0.5 to 1 ml पर kg पर आर होता है, चिल्ड्रन में 1 to 1.5 ml पर kg पर आर होता है. सो वेरी इंपॉर्टेंट इसमें है कि द 8 hours आर काउंटेड फ्रॉम द टाइम ऑफ बर्न. जब चला था वो इंसान उधर से 8 hours गिना जाएगा, नॉट फ्रॉम टाइम द पेशेंट रीचेज द हॉस्पिटल. जब से जला है तब से वो टाइम को गिन के हम उतना फ्लूइड कितना रिकॉर्ड है ये सब करके हम देंगे, कितना देना है, कब देना है. ओके, यूरिन आउटपुट. ना हाउ डू वी मॉनिटर वेदर अवर फ्लूइड रिसाइटेशन इज़ एडुकेट. हम कैसे मॉनिटर करेंगे कि हम जितना दे रहे हैं उतना एडुकेट है, तो हम यूरिन आउटपुट ही मॉनिटर करते हैं. सो मैंने जैसे बताया अडल्ट्स और चिल्ड्रन में इतना होता है. सो द फ्लूइड आर एडजस्टेड अकॉर्डिंग टू द यूरिन आउटपुट. नाउ कम्स पेज नंबर 6 में और इज वुंड मैनेजमेंट. सो फ्लूइड रिसाइटेशन के बाद हम वुंड मैनेजमेंट करते. तो फर्स्ट क्लीन द वुंड, देन डिब्राइडमेंट जिसमें आता है ब्लिस्टर, रिमूव ब्लिस्टर्स, डिवाइटलाइज टिश्यू, Apply topical antimicrobial agent, for example silver sulfadiazine 1%. Cover with sterile non-adherent dressing. This protects the wound. Fifth is tetanus prophylaxis, and tetanus prophylaxis बिल्कुल भूलना नहीं है, ठीक है, डोंट फॉरगेट इट. सो ईजी सीक्वेंस क्या होता है वुंड मैनेजमेंट का? क्लीन, डिब्राइड, एंटीमाइक्रोबियल, ड्रेसिंग and then tetanus. Okay, now page number 7, pain relief. Now let's discuss the other aspects of management. So the pain relief, burn can be extremely painful, so we give IV opioids, analgesics can be used for pain relief. Antibiotics are given if infection is present, and nutritional support, burns patient need good nutritional support. High calorie, high protein diet, vitamins such as vitamin C, A and zinc. Physiotherapy, this is very important. Why? Because burns can result in contractures, so early mobilization prevents contractures. Okay, treat complications promptly. Any complication should be recognized and treated early. Psychological support, burn can also have a major psychological impact in the patient. Psychological support is an important part of management. So remember this box: early fluid resuscitation plus infection control plus nutrition plus physiotherapy is equal to better outcome. Now page number 8, surgical management. Early excision of dead tissue. Dead tissue can be removed early. Skin grafting, next is skin grafting. Split thickness graft most common, and full thickness graft used for smaller areas such as face. Flap coverage, flaps are used when we need coverage of exposed vital structure. And escharotomy, now this is very important term, escharotomy. This, so eschar is hard leathery tissue formed in a deep burn. Okay, an incision is made through the eschar to relieve constriction, and according to notes, indications include that is the circumferential chest burns, जिसमें आते हैं respiratory distress, circumferential limb burn, जिसमें आता है vascular compromise. So the easy way to remember this surgical management is chest breathing problem, limb blood supply problem. So circumferential chest burn plus respiratory distress is equal to escharotomy, and circumferential limb burn plus vascular compromise is also equal to escharotomy. Okay, तो सर्कमफेरेंशियल चेस्ट बर्न के साथ रेस्पिरेटरी डिस्ट्रेस आएगा, सर्कमफेरेंशियल लिप बर्न के साथ वैस्कुलर कॉम्प्रोमाइज आएगा. नाउ पेज नंबर 9, स्पेशल कंसिडरेशन. वी हैव 3 स्पेशल टाइप्स ऑफ बर्न्स टू रिमेंबर. इनहेलेशन इंजुरी, सस्पेक्ट इन क्लोज स्पेस फायर्स. Always suspect inhalation injury in closed space fires. For example, imagine a person trapped inside a closed room during a fire, and they are not only exposed to the fire, they may also inhale smoke and hot gases. So signs include facial burn, soot in mouth, hoarseness, and management include इसमें airway, oxygen, humidified air. सो इसको याद कैसे रखना है? क्लोज स्पेस प्लस फेशियल बर्न्स प्लस सूट प्लस होर्सनेस इज थिंक इनहेलेशन इंजुरी होना. इलेक्ट्रिकल बर्न्स आर स्पेशल बिकॉज द इंजुरी मे नॉट ऑलवेज बी ऑब्वियस एक्सटर्नली. लुक फॉर कार्डियक एरिथमिया एंड रैप्डोमाइलोसिस. सो थिंक ऑफ द इलेक्ट्रिकल बर्न इज इक्वल टू थिंक हार्ट प्लस मसल. ओके, कि कार्डियक एरिथमिया हार्ट एंड मसल रैप्डोमाइलोसिस. Now chemical burns require immediate action. इसका management remove the chemical, then irrigate copiously with water. So the key phrase is remove plus irrigate. So now we come to the page number 10, that is final summary. Okay, बर्न्स रैपिड रिविजन अगर हम करें तो क्या हुआ फाइनल समरी में कि टिश्यू इंजुरी कॉज्ड बाय हीट, इलेक्ट्रिसिटी, केमिकल्स, रेडिएशन और फ्रिक्शन. क्लासिफिकेशन अकॉर्डिंग टू डेप्थ: फर्स्ट डिग्री सुपरफिशियल, सेकेंड डिग्री पार्शियल थिकनेस, थर्ड डिग्री फुल थिकनेस, फोर्थ डिग्री एक्सटेंड इनटू सबक्यूटेनियस टिश्यू, मसल एंड बोन. एक्सटेंड आया अकॉर्डिंग टू एक्सटेंड रूल ऑफ 9, लंड एंड ब्राउडर चार्ट, पाम मेथड. कॉम्प्लिकेशंस आया लोकल, सिस्टमिक एंड मैनेजमेंट में ABC, रिमूव सोर्स, रिमूव टाइट क्लॉथिंग ज्वेलरी, कूल विथ रनिंग वाटर, कवर, फ्लूइड रिसाइटेशन, वुंड मैनेजमेंट, न्यूट्रिशन प्लस फिजियोथेरेपी, सर्जिकल मैनेजमेंट, रिहैबिलिटेशन. So this are all about the burns, okay, and that's the complete topic of burns for your BDS third year general surgery exam preparation. Now I don't want you to just memorize this topic. When you see a burn case, ask yourself 5 questions. How deep is the burn? How extensive is the burn? What complications can occur? Does the patient need resuscitation and fluids? Does the patient need wound or surgical management? So if you understand these 5 things, the entire topic becomes much easier. And guys, if you want the exact handwritten exam oriented general surgery notes that I am teaching from in this lecture, I have already prepared them for you. You can find these notes on my Instagram page, Dent Mindset. So go to my Instagram handle, Dent Mindset, and grab the general surgery notes from here, okay? And they are specially useful for BDS third year university exam preparation because the content is arranged in a simple, point-wise and easy to revise format. So don't also forget to follow Dent Mindset and save these notes for your revision. So if this lecture helped you understand burns in a simple way, don't forget to like this video, subscribe to the channel and share it with your BDS friends, and I will see you in the next lecture. Till then, keep studying smart, keep revising, and I will see you soon. Bye.